Welcome to another edition of UroChat. My name is Steve Cooper, and in addition to having stage 4 prostate cancer, I also struggle with urinary incontinence and also a topic that's very difficult to talk about and that many men do not want to discuss, which is erectile dysfunction. Today, we have the honor of having Dr. Shawn Blick with us here, and we're going to have a conversation about erectile dysfunction. So first of all, Dr. Blick, thank you for being here.
Thank you. It's a pleasure.
So to get us started, do you mind sharing with us some of your background? We would like to get to know who you are, where you grew up, where you went to school, things like that.
Well, I grew up in Long Island, New York, in a place called East Northport, and I went to undergraduate college at a place called Cornell University up in Ithaca, New York. I did my medical school training in Mount Sinai, New York, which included about 6 months of training at Sloan Kettering Memorial Cancer Center before I then went on to do a residency at Beth Israel Medical Center in urology. Thereafter, I then moved to Phoenix, Arizona, where I started a group called Valley Urologic Associates, and that's how I began my career.
Fantastic. What was the reason that you chose to go into urology when there's a lot of practices out there?
It's a good question. Urology is a unique specialty, but what really drew me to it was actually the people. The people were happy, they were enjoying what they were doing, they were having impact, and I really thought that would make a difference in me. So I chose it a lot based on the people, but it was also about the unique features of urology as a subspecialty. Urology is unique because it includes both medical and surgical components, and there's just a wide variety of technologies that keep it exciting all times.
That's a good segue into what I would love to talk about, which is the focus of your practice and your practice in general. You have a practice. What do you focus on specifically, and then what other type of work do you do generally?
So in my group, we all have subspecialties. And again, my group is Valley Urologic Associates. We all take a subspecialty, but we all do general. As years would go on, and as a leader of my group, I began to subspecialize in an area called prosthetic urology, which really focuses on using implants to help men restore their erectile function and their urinary continence. So that became my ultimate expertise, including the topic of men's health and men's sexual health as a global topic. So it evolved over time, but that's what I specialize in now.
So prosthetic urology, is that something that you learned during medical school and residency, or was there an additional training phase after your 6 more years of your training?
Yeah, no, it was something that was a very strong part of my residency training, but then like anything else, you take a membership in the Sexual Medicine Society of North America, and you do continuing education, and eventually through time and experience you evolve and subspecialize in the area. So I didn't actually do a fellowship in this area, but through many years of private practice and continuing education have evolved into a national leader in the space.
Oh, that's great. One thing that I'm very intrigued by doctors that specialize in prosthesis. Do you have, sometimes we call it a robot, those of us that have the implants, or it's, some type of, robotic, assistance. Do you have an interest in engineering or robotics or anything like that that kind of ties in with your work?
Well, in actuality, I do not have a very specific major or expertise in engineering or robotics per se. My major in college was nutritional biochemistry, so I was very focused in on medical science as a topic, so that's kind of what drew me probably to medicine ultimately. But I have a fascination with the technology and the ultimate outcomes in patients and the power and the impact that I have on changing people's lives. That's what I think draws me to it.
The technology then.
The technology and impact on life.
Fantastic. And can you talk about some of the outcomes just in general that you've seen and how that's changed quality of life? And then later on we'll get into some of the details about the procedures.
Well, if we're talking about penile implants as a long-term solution for erectile dysfunction, it's an absolutely life-changing, transformational procedure for the men who receive them. Men move from a position where they're feeling a little less whole as a man, where their self-esteem has been compromised. Psychologically, they feel less self-confidence, less self-esteem, and there's huge impact on the intimacy in their relationship. When we fix their erectile dysfunction, suddenly that changes. Independent of all the sex, by the way. It's a wonderful thing to sexually enhance a male and make them sexually invincible. But it's another thing to be able to psychologically improve their profile and improve their relationship, improve their entire quality of life.
So there's a difference then just by being able to perform versus actually having intercourse. And do you think that's one of the things that when we lose that ability as men to perform, that has multiple ramifications?
I'd say when a male feels like they can't perform, they feel a little embarrassed. They're less likely to be intimate with their partner because possibly they can't achieve a positive outcome. So internally it hits the male ego. By just restoring their ability to have normal relations, even if it's once a month or once a year, that has a powerful impact on the male psychology, their sense of manhood, their sense of self-confidence, their sense of self-esteem. And that just transfers into better intimacy and more likely to engage in intimacy.
So this is much more than just a primate desire to have intercourse. This really digs into a really deep level of psychology.
It's multifaceted, right? I think that there's more to it than just simply fixing the sex. It's extremely important to the satisfaction of the couple and the male pleasure, but it's also the psychology of it as well that restores, that makes someone more self-confident, more self-esteem, more likely to engage in intimacy.
Dr. Blick, when we first met, we had a great conversation about a patient's positive attitude and then outcomes through whatever procedure they're going through. Can you share with us some of that insight and some of the work you've done and how you've seen that translate into your practice where patients have come to you with devastating diagnosis, but because of positive attitudes and also treatments, of course, tend to do pretty well?
Yeah, it'd be my pleasure. In college, I wrote a paper on a topic called Psychoneuroimmunology, which just talks about the relationship between the mind and the immune system. And what we're finding is that the immune system may actually be sort of like a sixth sense, meaning that the mind can connect with the immune system biochemically, and when the mind is strong and we have positive attitude, we affect better immune system, we fight disease better, we tend to survive better. So I've had patients that I can easily see that were more engaged, certainly positive about trying to beat their disease. They wouldn't take failure as an option, and I think they ended up with better outcomes because of that. They beat their odds because of that, and you were a perfect example of that, clearly. You had such an advanced state of disease, and it's really truly because of course you had great medical care, but you also really had an incredible attitude and a will to beat your disease, and that engagement facilitated an awesome connection between your mind and your immune system to help beat your disease.
I appreciate that. And a current example I've seen is, Alex Trebek was recently diagnosed with stage 4 pancreatic cancer. Sure. And in his video, he talked about, and I think it's a really powerful point, that he has to live more than 3 years because he has a 3-year contract at work. Exactly. And so that's kind of what you're talking about, right? Is when people have goals and they have ambitions, those things are pretty powerful, aren't they?
Absolutely, yeah. Well, there's no question that the mind and immune system are connected, and that a positive attitude will affect a better clinical outcome.
Fantastic. Where can patients contact you?
So people can connect with me through my website, which is drblick.com. Spell out the word doctor, that's drblick.com, and they can call the number 602-931-4556 to make an appointment, or check out my podcast. It's called Blick's Dicks. It's raising awareness about men's sexual health and men's health in the United States and creating a new metaphor for men's health in the USA.
Fantastic. Thank you.
Thank you.